So welcome to this session, and thank you for joining me. I'm Sukhdev Singh, and today we are talking about something I believe is the single most important shift happening in our profession right now. The title of this deck is deliberate: the foundational context. Not a trend, not a tool, but the context in which everything else in library and information science now operates. Here's the thing. For years we treated AI as one more topic to keep an eye on, alongside blockchain, alongside the metaverse. That framing is now out of date. What this 2026 status report and strategic framework argues is that AI has stopped being a subject we study from a distance. It has become the environment we work within. And that changes what it means to be a library and information science professional. Let's start by looking at exactly how that shift happened. So look at this diagram carefully, because it tells the whole story. On the left, you see the past, information science sitting at the center, with AI orbiting alongside blockchain and the metaverse, just one more satellite among several. On the right, you see 2026, and the picture has flipped completely. AI now sits at the center, and its metadata, collection management, and information literacy that orbit around it. Here's the evidence. Gale 2026, held virtually, reached its 1,000-person capacity instantly, and organizers had to force a YouTube live stream just to accommodate demand. At the IFLA World Congress in Busan, 3,000 professionals engaged with AI woven directly into public library and information literacy tracks. And at ICL and ICTL 2026, AI wasn't a side session, it was the core theme of international library management. So the question isn't whether this shift happened. It's how ready we actually are for it. Let's look at the ground reality in Indian libraries. Now let's talk numbers, because numbers keep us honest. Urban Indian libraries are showing an 85% AI adoption rate. That's a strong figure, and it reflects real momentum. But rural Indian libraries are sitting at just 20%, and that gap is not a footnote, it's a critical fault line running through our profession. Put those together and, per Sudhanshu Shekhar Mishra's January 2026 figures, the overall system adoption rate comes to 52%. So we are just past the halfway mark nationally, with a deeply uneven distribution underneath that average. On the infrastructure side, there's genuinely good news. NDLI 3.0, the National Digital Library of India, now supports natural language processing across 14 languages, serving 94 million registered users with access to 130 million resources. That's serious national capacity. But capacity without equitable reach is only half the job. So how is this capacity actually being used on the ground? Let's look at that next. Here's the thing, AI in libraries has stopped being an experiment. Libraries with effective AI implementation are seeing a 45% reduction in query resolution time, and this isn't happening in pilot projects tucked away somewhere. It's happening in daily operations. IIT Kharagpur is using it for automated tagging. Delhi University is using it for discovery. ISI Kolkata is using it for journal indexing. This is routine practice now, not novelty. So how do professional bodies respond to something that's moved this fast? The PLA and ALA pragmatic framework gives us 3 clear principles. First, reject the binary of blind embrace versus outright dismissal, neither extreme serves our patrons. Second, focus squarely on privacy, bias, and transparency, because these are the risks that actually matter. And third, scrutinize AI outputs exactly as we've always evaluated traditional sources. That third point brings us to something deeper: what does AI literacy actually mean, and who gets to define it? So here's where I want you to pay close attention, because this slide is really the argument of the whole presentation. 4 groups are currently competing to define what AI literacy means. Technology defines it by usage, knowing how to prompt and operate tools effectively. Government defines it by governance, policy, regulation, compliance. Computer science defines it by mechanics, understanding models, algorithms, and neural networks. And then there's us, information professionals, and we define it by truth. Our question is different from all the others. How do you know whether what the AI told you is actually true? That means evaluating sources, verifying claims, recognizing bias, and understanding provenance. None of the other 3 groups are built to ask that question the way we are. So if AI literacy is genuinely about truth, then the profession best equipped to lead this conversation isn't technology, government, or computer science. It's us. And that's not a new skill we need to learn from scratch. Let me show you why. Let's talk about something that I think gets lost in all the excitement around AI. It is not a technology challenge, and it is not a new subject that we need to master from zero. Cross both of those out. What we are actually dealing with is information literacy applied to a new environment. For decades, librarians have helped their communities assess authority and make informed decisions in noisy, cluttered information environments. That has always been our core skill. And here's the point, that skill is not becoming less relevant in the AI era. It is the exact requirement of the AI era. Generative AI produces fluent, confident, plausible-sounding text, and someone needs to help people tell the difference between what sounds true and what is true. That's a librarian's job description, just applied to a new kind of noise. So if this is fundamentally about verification, what does that role look like in practice? Let's look at the model. So look at this flow. On the left, you have generative AI models, represented here as tangled, chaotic shapes, because that's really what raw AI output can feel like without structure around it. On the right, you have the community user, waiting for something they can trust. And in the middle sits the library, positioned as the verification layer. This isn't a passive role. It means curating directories with clear data on privacy, costs, and limitations, so people know exactly what they're using. It means integrating AI evaluation directly into existing job support and business workshops, meeting people where they already come to us. And it means creating safe parameters for staff and community experimentation, so people can explore without unnecessary risk. The line at the bottom of this slide says it plainly. The ability to assess credibility is now more valuable than the ability to access information. Access is no longer scarce. Trust is. Now, let me show you what happens when we don't claim this role, using a case study close to home. Here's a cautionary tale, and I think it's an important one for us to sit with. Look at this bar. One side, clinical practice, is fully occupied. The other side, information science, is empty. Physicians, surgeons, and hospital administrators understandably took the lead in building the Indian Association for Medical Informatics. Understandably, because they showed up. But here's the uncomfortable truth, the missing voice was ours. Medical informatics fundamentally asks how health information should be organized and retrieved. That is a question library science has studied for an entire century. We had the expertise. What we didn't have was presence in the room. We were not excluded from that conversation. We were simply absent from it. And that absence has a cost, because a discipline builds its foundations with whoever is present at the founding table. So what would it have looked like if we had been there? Let's look at exactly where our strengths would have mattered most. This slide, for me, is the clearest possible case for why our absence in medical informatics mattered. On the left, you have information science strengths, knowledge organization, high-quality metadata, controlled vocabularies, and information architecture. On the right, you have AI system necessities, reliable clinical decision support, automated evidence retrieval, transparent neural outputs, and intelligent health records. Now look at how densely those two columns connect. Every single strength on the left maps directly onto a necessity on the right. This isn't a loose analogy, it's a near-perfect fit. And the line underneath it says exactly why AI relies entirely on well-organized knowledge. Without controlled vocabularies and clean metadata, even the most sophisticated clinical AI system produces unreliable, opaque results. This is precisely the kind of table we should have been sitting at from day one. So knowing all of this, what do we actually do with it going forward? Let's close with the call to action. So let's bring this home. The window to define AI literacy for our profession, and for the communities we serve, is closing, and it's closing quickly. Here is the line I want you to take away from this entire presentation: we are not support staff. We are system partners. Tech companies have marketing budgets. Governments have policy levers. What we have is something neither of them can manufacture: credibility. We have the credibility to design systems that are transparent, reliable, and fundamentally true, because that has been our discipline's work for a century. The medical informatics story shows us what happens when we arrive late. The verification layer model shows us exactly where we belong instead. So the task in front of every one of us, whether you work in an urban library with 85% adoption or a rural one still catching up, is the same: claim the role. Thank you so much for watching. If this resonated with you, do subscribe, and I'd love for you to join the AI4Lib community, where we are working through exactly these questions together.